I contacted one of our local emergency departments and found out that if the emergency room doctor actually suspects that the patient has TMD symptoms, that the painful symptoms, the severe, unrelenting headaches, bad headaches, bad earaches, bad neck pain is coming from the temporomandibular joint, what do they do? Well, I'm going to tell you about it. I'm not going to identify the hospital because it's not very flattering at all. So I'm not going to identify which hospital in Middle Tennessee this is directed by, but they have a literal handout that goes on for 4 pages, which by my observation and opinion, now next is opinion. I always separate fact from opinion. This handout is given to satisfy the attorneys so that they can honestly say they did something. They did something for this patient when they came in. But I just want to read part of this. I'm not going to take you through the whole thing, but it's all boilerplate. It's not smoke and mirrors, because some of what is on here is factual information, but it's word salad to satisfy the patient that something is understood about it and something is being done when actually nothing is being done. But I just want to read a couple parts of this for you from actual document generated by one of the better known emergency departments here in Nashville, Tennessee. And it talks about TMJ syndrome, temporomandibular joint syndrome, which is really not accurate. I talked many times before. Temporomandibular joint disorder is one disorder. It is a syndrome actually because it has multiple problems. It has multiple things that going on, symptoms caused by one fact is called a syndrome. So correctly so, they do call it a syndrome. And I'll just read you the first paragraph and a couple other parts. TMJ syndrome, the temporomandibular joint is the joint that connects the lower jaw to the skull. You can feel it in front of your ears when you open and close your mouth. TMJ disorders cause chronic or recurrent pain and problems of the jaw and the muscles that control the jaw movement. Symptoms of TMJ disorder are usually relieved with minor treatments. Not true.